Did you know that October is Eczema Awareness Month? And you're wondering what eczema is. So, before you go anywhere, eczema is Greek for boiling. Bet you didn't know that. And it is a skin condition that is characterized by getting patches of dry, itchy and irritating skin on certain parts of the body, and it can affect anyone ranging from a child to an adult. And so there are no known causes, specific causes of eczema, but then it is thought to be as a result of combination of environmental and genetic factors. Genetic factors to mean it can either be passed on from a parent to the offspring, or it is associated with other allergic diseases such as asthma or allergic conjunctivitis. Environmental factors to mean that it can come as a result of climate change, as a result of psychological stressors, and contact with irritants such as jewelry, laundry soaps, perfumes, some jellies, and those kinds of things. So eczema presents, as I'd said, with patches of dryness and itchiness and a lot of irritation, but in its severe state, you can have some weeping and crusting and also bleeding because of excessive scratching. That is why eczema is Greek for boiling. To refer to the severe bit of eczema. So, as I'd said, it can affect anyone, and for that reason, we can call them stages of eczema in life. So there is infantile eczema, childhood eczema, and adult eczema. Infantile eczema is for children between 0 to 18 months, childhood eczema from 18 months to 12 years, and adulthood eczema from 12 years onwards. So in infantile eczema, it commonly affects the cheeks of the baby, and once they start crawling, you'll see it on the knees. There'll be, of course, irritation, dryness, redness of the skin in lighter babies, and unusual darkness of the skin in darker skinned babies. It often gets worse with crying, having a flu, with teething, and with climate change. For childhood eczema, it is commonly found on the folds of the body, which are called the flexures. So the elbow folds, the knee folds, sometimes the neck, the eyelids, and the wrists. And in adulthood eczema, commonly it's found on the folds of the bodies, the flexures, the elbow folds, the knee folds, and you can find it also on the vermilion of the lip, that is the border of the lip. And in adolescent females, can also be found on the nipples. So all this said, how do you go about eczema? Given that eczema is set on the premises of dryness of the skin, the number one and most important thing is to ensure that your skin is always moisturized at all times, because when the skin is dry, there is loss of moisture into the air. When you apply the emollients, the heavy gels, they help keep the moisture in the skin and therefore reduce the irritation and the feeling to scratch. Secondly, now that we've said some of the contributing factors can be irritants like jewelry, some laundry products, you can avoid them as well if you know them, and try as much as possible avoid psychological stressors. I know climate change is inevitable, but hey, we'll survive through it. So in light of all these things, in addition to taking care of yourself, it is also important to visit a dermatologist who is able to ascertain the extent of your eczema. They can advise on life modification styles, or also give you a cream to apply in the event the eczema appears. So that said, research has had it that 30 to 50% of children who have infantile eczema are likely to develop asthma later in life, so parents should be on the lookout for that. But good thing about eczema is that as it progresses, it gets better. So you might have a person who had very bad eczema when they were really small, but eventually as they are growing older, it either disappears, or if it's there, it's in very mild cases. So I am an eczema champion myself, and you too can be an eczema champion.